centers and how that is trending in the right direction. It's something to be happy about. You'll also talk about the new CDC, some of the new CDC guidelines or recommendations, and some of our revisions on the vaccine dashboard. We'll also hear from Dr. Weaver. She will put some detail to some new eligibility cohorts for populations that are going to be coming online, age and comorbidities, and how that affects the equation in terms of supply and demand. Dr. Weaver will also touch on, I believe, kind of the slow uptake in the 50 to 59-year-old age grouping, slower than previous groupings. And then also, Dr. Weaver, I hope you will give an update on, I'm going to speak to it very briefly, but give an update on our first experience with a mass vaccination site that we just had this past weekend in our capital city here. And then Jake Sipe, who is with the Housing Authority, will also give us some updates on our state rental assistance portal that's up and running. He can speak to that, and also about the eligibility for those Hoosiers who are in need, going on, not just the last 12 months, but going on the next 12 as well. So we look forward to that. But I did want to just at the very outset of the hour is to thank you, Dr. Box, and to thank Dr. Weaver, and to thank everyone at the Department of Health. You're quick to point in this case, I guess, 275 staff members. It was staffed by 275. When I went out there, I was envisioning, if every one of them had a yellow vest on, like the volunteers at the Indianapolis Motor Speedway on race day, and leading up to it, it was an enormous feat to pull off. And in my opinion, I may be biased, but it was flawless. And from the feedback that I received consistently, far and wide, because, by the way, I mean, it's such an iconic backdrop, and it was good that, some people checked off a bucket list item. They got vaccinated, first and foremost, but they also were at the IMS. And so we saw hundreds of people, actually. I shared this with Mayor Hogsett yesterday. Hundreds of people come from surrounding counties. We saw 23 people drive up from Dearborn County. We saw people come from all over the state. And, I'm happy that they got vaccinated. But it was an enormous feat to pull off. And when you think about the staff at the IMS itself, how gracious,
great partners,
professional, just could not have had a better venue, fully staffed. When you think about our Indiana National Guard members, when you think about IU Health, when you think about the Marion County Health Department,
our EMS, paramedicine support, and of course Indiana Department of Health, and all of our
you guys were the tip of the spear. You were leading the charge, and when I think about how that was pulled off, it gives me a lot of encouragement, understanding that now we're moving on to Sellersburg. That's fully booked already. That's a great thing down in southeastern Indiana. And then we're in Gary on the 20th and 21st of this month. That's a great thing. You've got multiple sites there. Maybe you or Dr. Weaver can speak to it. So that's another value add to the whole proposition. And then we'll be up north in South Bend at Notre Dame, and that really kind of hit home with me. There's Father Soren, who made the trek from Vincennes up to South Bend back in 1842. I remember this because I took a few of the steps in honor of that a few years back. But when he set out to start Notre Dame, literally, he said that he wanted that university, that school, to be one of the most powerful means of doing good for this country. And he went on to say, at least that was his conviction. and that he hoped that he was not proven to be deceived. And I can tell you, I trust Father Soren is looking down, and he is comforted by the fact that Notre Dame continues to do good. And thank you to Father Jenkins and everyone in Notre Dame and in Gary and in Sellersburg and in Indianapolis, because we are doing good on a scale that few seldom have the opportunity to rise to that moment. Mm-hmm. And what was true in 1842 is true today. And this is our moment. And I just watching the volunteers and the staff members over this past weekend at the IMS, I just could not, I've never been so proud in my life. So thank you.
Well, you're welcome. It was very uplifting. It
really was. People, as you said early on, people feel like they're getting their lives back. And I think they are. And so I'm proud and I'm grateful. I'm also, what I saw gave me a real sense of optimism. Again, you'll speak to the numbers. That optimism is rooted in the data, and the data is undeniable. And when I think about the number of Hoosiers, which you will see here in just a few seconds, that are getting vaccinated, fully vaccinated, when I see the number of doses that we're told are going to continue to come online, next month being another, we're going to have a lot of doses added into the equation by this time next month. When I see the number of, especially the most at-risk Hoosiers, the comorbidities now being put into the equation, the 50 and up, and as soon, over time we'll drop down 45, 40, et cetera. That gives me a lot of optimism that the folks that we're most worried about are going to have access or the opportunity to get vaccinated. Mm-hmm. And that's, again, the good news. Now, they say you can lead a horse to water, but you can't make him drink, and we can't make anyone do anything in terms of whether they want to or not. But the number of Hoosiers, and this is not a medical term, I'm, again, not a doctor, but when I look at the equations and I see the number of people vaccinated, the number of people who have had it, by the way, and we know that number, that the actual people who have had it that we don't know could be maybe twice. Yeah. I mean, Fairbanks could
10 times, maybe according to our original information.
So, we're still concerned about those potential reinfections or those variants. But again, this is not a medical term, but the space that those variants have to bump around in is getting smaller and smaller as we get more people vaccinated, as more people recover from having had COVID-19. So I get, we've come a long way, and here we are. And thinking about March Madness and how these brackets all, are going to unfold, it did get me thinking that it is time. I'm not just in a good mood for no reason, but it is time to look at the road ahead and to have a roadmap ahead. And so I intend on, over the next week or 2 weeks, delivering a statewide address talking about where we were, this is over the last year, where we currently are, and where we're going. And that we'll look at all of our policies as we do every day, every week. You've been doing it 24/7 for 365 plus days. But we'll look at our policies, we'll look at our guidance, we'll look at what the CDC, how things have changed there too, and we'll make sure that we continue to feel as good as we do today as the spring continues to watch things bloom. And with that, I will turn it over to Dr. Box.
Thank you, Governor. Good afternoon, Hoosiers. This past weekend marked a turning point for our state as the number of fully vaccinated Hoosiers surpassed the number of COVID-19 cases we've had since March 6th of 2020. To have that happen during our first mass vaccination clinic at the Indianapolis Motor Speedway was incredibly fitting. Racing history has been made many times over at the IMS, and over the weekend, we made history on another front. The joy and excitement we saw during the 4 days of the clinic were energizing for everyone that was involved. People drove from as far as Lake County and southern Indiana to receive a vaccine at this iconic site. Some people came by bus and then rode a golf cart to get their shot. People cheered, clapped, honked their horns as they left the garage bays after receiving their vaccine, and at least one person peeled a little rubber while exiting into pit row. Another person told us that the process went more smoothly than a Chick-fil-A drive-through line, and that was high praise indeed. And more than 16,500 people left the Speedway with a life-saving vaccine. We now have administered 1,178,265 vaccines in Indiana, which represents an increase of nearly 147,000 doses from last week. Of those individuals, 744,712 are fully vaccinated, up from 607,000 last week. We continue to see significant uptake of vaccine in our eligible populations. 72% of Hoosiers age 80 plus have scheduled or received a vaccine. 73% of those age 70 to 79 have done so. 60% of those 60 to 69 are getting vaccinated, and 37% of those ages 50 to 59 are in line or have gotten their first dose. These numbers include more than 138,000 first and second doses administered to residents and staff in long-term care facilities. Getting a vaccine signals the beginning of the return to the life we knew before COVID, and we now have official guidance from the CDC on what being fully vaccinated means. A person is considered fully vaccinated 2 weeks after receiving the final required dose. So 2 weeks after the Moderna or the Pfizer second dose has been given, or 2 weeks after your one dose Johnson & Johnson has been given. Under the CDC's guidance, if you're fully vaccinated, you will not have to quarantine or be tested if you do not have symptoms of COVID-19 after close contact with someone who is positive. However, if you live in a group setting, like a correctional or a detentional facility or a group home, and are around someone who has had COVID-19, you should still stay away from others for 14 days and get tested, even if you don't have symptoms. You also can visit with other fully vaccinated people indoors without wearing your masks and without staying 6 feet apart. You can visit with unvaccinated people from one other household indoors while without wearing a mask, or staying 6 feet apart if everyone in the household is at low risk for severe disease. This does not mean that fully vaccinated people are free to return to large mask-free gatherings at this time, and you still need to wear a mask when you're in public, at the grocery store, or at church. The CDC says the vast majority of people need to be fully vaccinated before COVID-19 precautions can be lifted broadly across the country. Just over 9% of the U.S. population has been fully vaccinated for COVID-19. Here in Indiana, 11% of our total population has been fully vaccinated. We also still don't know how effective the vaccines are against the variants of the virus. Early data shows that vaccines may work against some variants, but could be less effective against others, which means we should continue to take precautions that have been working. We need to continue to wear masks, wash our hands, stay home if we're sick, and get tested, practice social distancing so that we can protect the large number of people who are still not vaccinated. That's especially important if you will be in large groups from multiple households, or when you're around unvaccinated people who are at high risk of getting severely ill from COVID-19. This guidance won't apply to everyone, but it's definitely another step forward. We also are encouraged by our positivity rate, which stands at 3.1% today, which is down from last week's rate of 3.5%. We have seen another decline in the number of Hoosiers hospitalized with COVID symptoms. The number of Hoosiers currently hospitalized with symptoms of COVID has dropped below 700 for the first time since July. And hospital admissions for COVID have fallen below 75 a day, which is the lowest number we have seen since the fall. Our color-coded county maps also continue to move in a positive direction. The number of counties in blue on our 2-metric map has risen from 51 last week to 61 this week. We have 1 county in orange, but everyone else is in yellow. Our advisory map, which indicates the level of restrictions that counties must follow, shows just 1 county in orange, down from 3 last week, and no counties in red. 42 counties are now at the blue advisory level, up from 31 last week. The majority of the state remains at a yellow advisory level. The number of deaths we are seeing has fallen into the double digits consistently. Today, we reported 16 new deaths, which brings our total lives lost to 12,755 when you include both confirmed and clinically diagnosed deaths. It is heartbreaking to know that many of these deaths have occurred among Hoosiers who live in long-term care facilities. These vulnerable Hoosiers have borne a huge burden of this pandemic, from the number of cases to the number of deaths to the social isolation that has resulted from visitor restriction. But we're seeing improvements there as well. In December, we saw more than 5,300 cases in long-term care facilities. That number dropped to 665 in February, and those cases represented 2% of our cases statewide. Also in December, we recorded 1,447 deaths among residents of long-term care facilities, which accounted for 48% of all COVID deaths reported that month. That number dropped significantly in the following 2 months. In February, 227 residents of these facilities died of COVID, representing 33% of all COVID deaths. While we were grateful that these numbers are declining, this remains a sobering statistic that shows just how much this virus preys on our most vulnerable Hoosiers. Our elderly residents have also struggled with isolation due to visitation restrictions that were designed to prevent the introduction of new cases into long-term care facilities. We have issued new guidance regarding visitation to all Indiana facilities to allow residents more flexibility to leave their facilities. If those trips are less than 24 hours, they do not have to quarantine upon their return to the facility. In addition, we have made it clear that facilities must allow indoor visitation if their county has a positivity rate of 10% or lower and has had no new COVID cases in their facility in the last 14 days. We also increased the amount of time they must allow for visitation from 4 hours to 8 hours during the week and some hours on the weekend. As we continue to get more vaccine in arms, my hope is that we are able to further open these facilities so that families can be reunited and spend precious time with their loved ones. Please help us get there by getting any one of the vaccines available as soon as you're eligible. Finally, I want to alert you to some changes we'll be making to our vaccine dashboard. Prior to the arrival of Johnson & Johnson vaccine, we were showing you first doses administered and the number of people fully vaccinated. That second number reflected people who had received their second dose of Pfizer or Moderna, and those individuals were included in both counts. Now that we have the single-dose Johnson & Johnson vaccine, we have been adding individuals who received J&J only to the fully vaccinated list. To make this clearer, we will be updating our dashboard to better delineate the number of first and second doses administered. You'll be able to see how many single-dose vaccinations have been administered, how many two-dose vaccines have been administered, and the breakdown of first and second doses within that two-dose series. The most important count will continue to be those who are fully vaccinated. We also will begin breaking out doses administered into 5-year age groups instead of 10-year age groups to allow for better visibility into the vaccine uptake as each new eligibility group is rolled out. In addition, we will include a new tab that will better show the percentage of each age group that has received a first dose or is fully vaccinated, as well as better provide understanding of vaccine uptake in each county. Look for these changes in the coming days. Now, Dr. Weaver will provide updates about our vaccine rollout.
Thank you, Dr. Box. This week, we received our 2 millionth dose of vaccine. And as we celebrate these milestones, we are already looking ahead to additional opportunities to get vaccine into arms at different venues around the state. We have planned vaccination clinics at Ivy Tech in Sellersburg and at the University of Notre Dame this month. All appointments at those sites are already booked. These clinics will offer only the Johnson & Johnson vaccine, which requires a single dose. No second doses of Pfizer or Moderna vaccines will be available at these locations. If you are not able to keep your appointment, please cancel in advance so others who are eligible can take your slot. And if you are coming to these clinics, please ensure that you can show proof that you live in Indiana and meet the current eligibility requirements upon arrival. We will not be able to vaccinate residents from other states. While we have at least one vaccination clinic in every county, we know that many Hoosiers have transportation challenges or other needs that might make it harder to get to a clinic site. That is why we are hosting a pop-up clinic on March 20th and 21st at Calumet New Tech High School in Gary. We are preparing to deploy our mobile vaccination units to underserved areas across the state for 4 days a week, beginning the week of March 22nd. We also have been working to ensure that Hoosiers who have specific conditions that put them at higher risk of severe illness or death from COVID are able to get vaccinated. We started by vaccinating people who are currently undergoing dialysis, and so far, more than 4,000 have received a vaccine. More will continue to get their vaccine this week and next. Last week, we began sending text messages notifying individuals with Down syndrome, people diagnosed with sickle cell disease, individuals who have received a solid organ transplant, and people who are undergoing cancer treatment or have had cancer treatment within the last 3 months that they are also eligible for a vaccine. In total so far, we sent more than 31,000 text messages to alert these individuals of their eligibility. Additionally, we have added other high-risk conditions to the list of those who are eligible. Those include Hoosiers with intellectual or developmental disabilities who are receiving home or community-based services, early childhood conditions that are carried into adulthood, including cystic fibrosis, muscular dystrophy, people born with severe heart defects that require specialized medical care, people with type 1 diabetes who have been hospitalized in the past year, PKU, Tay-Sachs, and other rare inherited metabolic disorders, epilepsy with continuing seizures, hydrocephaly, microcephaly, and other severe neurologic disorders, people with asthma who have been hospitalized for this in the past year, alpha and beta thalassemia, spina bifida, cerebral palsy. We're also opening eligibility to people who require supplemental oxygen or have a tracheostomy, have pulmonary fibrosis, alpha-1 antitrypsin, have weakened immune systems due to blood or bone marrow transplant, immune deficiencies, combined primary immunodeficiency disorder, HIV, daily use of corticosteroids, use of other immune weakening medicines, or are receiving tumor necrosis factor alpha blocker or rituximab. We have notified healthcare providers across the state about this expanded eligibility for special populations to aid us in helping identify their patients. And these at-risk individuals will receive a unique link from the Indiana Department of Health to sign up for vaccine. We will work with FSSA to register Hoosiers with intellectual or developmental disabilities for a vaccine, and this group includes nearly 19,000 people, ages 16 to 49. These individuals and their providers receive direct communication on how to register. If you believe you or your loved one qualifies, it is appropriate to reach out to your provider to ensure that they are submitting your information. After the information is submitted, it does take 24 to 48 hours before you are notified. Please be patient as providers across the state work to identify their appropriate patients. Starting Monday, per direction from the White House, we will open eligibility to educators and support staff. The list is defined by the CDC and includes teachers and staff in pre-K through high school, child care centers, Head Start and Early Start programs, licensed child care providers, including center-based and family care providers, classroom aides, bus drivers, janitors, counselors, administration staff, cafeteria workers, and substitute teachers. After we make this group eligible, we will continue to expand access to vaccine as quickly as supplies permit. Our plan is to next open eligibility incrementally to the 40 to 49-year-old age group. We were notified that we'll be receiving an additional 16,000 doses of Pfizer vaccine, and we are still not certain when we will receive additional Johnson & Johnson vaccine. So we're being very careful about how we allocate the nearly 54,000 doses we received initially. As Dr. Box noted, more than 16,500 of those doses were used to vaccinate people at the Indianapolis Motor Speedway last weekend. We have allocated more than 13,000 additional doses to our clinics in Sellersburg, Notre Dame, and Gary. The remainder have been allocated to hospitals, local health departments, and FQHCs, and will be used for a variety of purposes, including community outreach for vulnerable populations. We are thrilled to get every dose available to us, and will get shots in arms as quickly as possible. And if you are in your 50s, I encourage you to sign up for your vaccine as soon as possible. We are seeing a lower pace of vaccine scheduling in this group and want to encourage Hoosiers to get this protection as soon as it is available to them. As I close, I want to share a picture of the first shipment of Johnson & Johnson vaccine when it arrived in Indiana. This was the first Indiana shipment that was packaged in Kentucky, and everyone who helped pack it signed the box. I think this illustrates how much the vaccine means to everyone involved, not just those who are getting the shots, but to those who have had a role in every step of the way.
Thank you, Dr. Weaver, and you're probably now doing the routine where you and Jake switch spots. So Jake Sipe will be up next. He's with our Housing Authority to talk about our rental and our utility assistance portal and program. Jake?
Thank you, Governor. My name is Jacob Sipe, Executive Director at the Indiana Housing Community Development Authority. Applications are now being accepted for the Indiana Emergency Rental Assistance Program. This program is designed to assist renter households that are unable to pay rent and utilize utilities due to the COVID-19 pandemic. Renters in need of assistance are encouraged to visit indianahousingnow.org. There they will find additional information about the program and a link to apply. We have also posted information and resources at indianahousingnow.org for landlords, utility and home energy providers, as well as internet providers. The application is available in English and Spanish. If you are unable to complete the application online, please call 211. After providing your zip code, you can press 3 to speak with someone about the Indiana Emergency Rental Assistance Program. There are eligibility requirements. An eligible household under the Indiana Emergency Rental Assistance Program, as defined by the U.S. Department of Treasury, is a renter household in which at least one or more individuals meets the following criteria: qualifies for unemployment or has experienced a reduction in household income, incurred significant cost, or experienced a financial hardship due to COVID-19, demonstrates a risk of experiencing homelessness or housing instability, has a household income at or below 80% of the area median income. Provided below are examples of 2, 4, and 6-person household income limits. Eligible renter households may receive up to 12 months of assistance. This includes forward-facing rent and rental arrears. Other assistance includes utilities, home energy, and internet arrears. Any arrears may be for expenses incurred since April 1st, 2020. In addition to the state of Indiana, 6 Indiana municipalities have received emergency rental assistance funding and are administering their own programs. Renter households living in these areas must apply through their local program and are not eligible to apply for the Indiana Emergency Rental Assistance Program administered by IHCDA. Those municipalities include Elkhart County, Hamilton County, Lake County, Marion County, the City of Fort Wayne, and St. Joseph County. Now, we recognize that one of the most effective ways to inform Hoosiers about this new program is through our network of community organizations like not-for-profits, community foundations, township trustees, faith-based organizations, and our elected officials. To assist these organizations with disseminating information about this program, we have developed a communication toolkit so it can be easily shared. The toolkit is available on IHCDA's coronavirus page. In addition to the Indiana Emergency Rental Assistance Program, the Communication Toolkit provides information on other key COVID-19 housing and utility resources. The mortgage assistance is available to Indiana homeowners who have fallen behind on their mortgage payments. They can apply for mortgage assistance through the Indiana Foreclosure Prevention Network at 877-GET-HOPE.org. Utility assistance is provided by the Low-Income Home Energy Assistance Program, which helps Hoosiers and homeowners and renters pay their heat and electric bills. The Coronavirus Eviction and Foreclosure Prevention Guide provides answers to frequently asked questions and resources for Indiana households financially impacted by COVID-19 to help them avoid eviction or foreclosure. Governor, that's my update this week on the Indiana Emergency Rental Assistance Program and our utility programs as well.
Thank you, Jake, and you're sticking around, I'm told. And so Chris Johnston is also available with the Office of Management and Budget. And just, I had a question. You mentioned someone peeled out at the Indianapolis Motor Speedway.
Yeah, I was actually there when it happened.
Was it you?
No.
Okay.
I was standing.
Because I watched you and Dr. Weaver, and you were kind of itchy. You want to start with the Q&A portion?
Dustin Grove, WTHR.
Afternoon, Dustin. Is this where he's unmuting himself?
Dustin, you want to try again?
So,
Heard you there for a fleeting second.
Okay, we'll come back to Dustin.
Okay.
Rob Burgess with the Wabash Plain Dealer.
Rob, good afternoon.
Good afternoon, Governor. At the office for once, you won't hear my children. So,
Given the overcrowding we've seen in some county jails and the number of virus cases and deaths we've seen at these facilities, are you still putting prisoners in phase 2 of the state's vaccination plans, or is there any chance that might be moved up at all? I was kind of thinking about with the slow uptake rate you've had in some of the 50 and over, could that be diverted to that population instead?
Yeah, Dr. Weaver, you want to talk about how we calibrate, including, I mean, we talked about the long-term care centers, but, and you know, the percentages and the numbers dropping there. Same true with our Department of Corrections facilities. Difference between correction or the state facilities and local jails. But Dr. Weaver or Dr. Box, you want to talk about how we calibrate moving down, covering more people, or giving more people access?
Sure. So we are constantly monitoring how many appointments we have available, how much vaccine we're receiving, and that is how we decide when exactly we will go ahead and move forward with the other group. So it's not that there is ever really extra vaccine, because there's always a plan for it. It's just how quickly we're able to move through our next steps. But I will say we are vaccinating prisoners who are eligible and are working on a plan for doing the same thing for jails in the future.
Yeah, and you mentioned, Dr. Box, earlier, I mean, just to keep things in perspective about how we're moving down, a 40-year-old with a comorbidity.
Yeah, just a
it's 10
40-year-old,
times.
just the age itself, their risk is 10 times higher to die if they get COVID-19 than the average 18 to 29-year-old.
Right. So, Rob, I just point that out to say we're letting the data kind of drive our decisions about who's most at risk, and that's the way we'll continue. Now, we've added in the impact of teachers into the equation as we get to Monday and beyond. So that'll affect the equation going forward, but hopefully as more and more supply comes in, we'll be able to get to more and more people.
Abdul Hakim Shabazz, ND Politics.
Abdul, afternoon.
Good afternoon, Governor. A couple questions for you and Dr. Box. First of all, for you, Governor, any side effects from the J&J vaccination shot that you got? Because I got mine Sunday. I was kind of had a headache and was a little bit tired the next day. So I'm interested to see if you experienced any side effects. And number two, this is for you or Dr. Box.
Okay.
What do you say to those Hoosiers who see Texas, Mississippi, Arizona kind of opening back up, getting rid of their mask mandates? Why not here? And why not we hear those numbers doing the same thing here, even though our numbers are moving in a more positive direction?
Yeah, I'll take both of them. Number two, or your second question is, we'll get there. We look at our numbers. We look at all those things I said at the very outset. Hospitalization rates, death rates, our PPE, our staffing levels, our hospitalization rates. We look at how many people have been vaccinated, how many people are going to get their second dose vaccination, how many people inside those comorbidity groups we're just starting to get to them right now. And so what's on my conscience is, have we made it available to those folks who are most at risk to save their lives, or at the least save them from going into the hospital and staying and having some potentially long-term effects that we just don't know the full extent of right now as we go through this last year together for the first time. So we'll get there. I'll have more to say in the next week or two. As I mentioned, the numbers, again, I'm very optimistic. I'm looking forward to this spring. But the states that you referenced, again, I'm laser focused on Indiana. And I want to make sure we, the people, continue to do the things that are responsible in terms of the impacts it has on our public health at large. Your first question was, what was your first question again, Abdul?
Did you experience any side effects
from
the J&J vaccination on Sunday? Because like I said, I got mine Sunday, had a little bit of a headache and kind of tired 24 hours later. So I was wondering if you felt any of those side effects as well, or any other different side effects.
I guess I could have used, it for an excuse here or there, but no, I really didn't. To be quite honest, the only things that I felt was sluggish for sure around dinner time that night, and I wondered, how this will develop. But when I woke up the next day, I just had a little soreness under my arm that got the shot, and then by I went down to southern Indiana that evening, and by 6:00 p.m. the next night, I had 0 after effects. And so I slept fine, ate fine. I did drink almost a half gallon of orange juice just out of someone told me that vitamin C, it might have been you, was good for you after a vaccination as well, and so I did.
Kathy from Ferdinand.
Good afternoon, Kathy.
Good afternoon. Glad to see you guys. I have 2 questions, and they're totally unrelated. The one actually has come to me from several people about churches where they are now saying you don't have to wear a mask, but they are singing. They're segregated a little bit in family groups, but there was concern from some of the congregation, and they wanted that to be addressed. So that was going to be my first question.
Want me to go ahead and take
Sure.
that? So, Kathy, I think that the concern that I have about churches is that there may be some medically vulnerable people in the church that haven't been immunized or vaccinated yet. And my concern would be that even those people come in and take their masks off, the risk for infection would be there. We know that shouting and singing can certainly spread respiratory droplets more. So I think we're just with, 11% of our population vaccinated at this point, a little bit early to just take off our masks and throw caution to the wind. I know it's a lot more fun to praise and sing and worship with your mask off. And I think we're really close to getting there, but I'd just like to see us hold out a little longer.
Yeah, and I would say don't tempt fate. I mean, we know how this how this spreads, and so no one is suggesting that we should stop worshiping or seeking out guidance. But let's do it responsibly and be around to do it next year too. Your second question?
Well, and I don't want this to sound insensitive, but it's my curiosity has gotten the better of me, and I keep wondering this.
Oh boy.
When you guys announced the first comorbidities, and Down syndrome was one of them, I was, trying to put that in the same category as organ transplant and things like that. And I just wondered about the comorbidity of that and why that was high risk.
Yeah, that's
I think it's a great question,
Yep.
and I asked Dr. Weaver that question exactly, so I'm going to punt that over to her because she and her advisory committee had a lot of good data on that.
Yeah.
So there's actually several reasons. Increased risk of sleep apnea, several individuals with Down syndrome have heart defects, higher risk of getting infections in general. And so some of the reports say that individuals with Down syndrome can have anywhere as high as 10 times the risk of death if they were to get COVID. So we were really excited to include them in that first group.
Eric Berman, WIBC.
Good afternoon, Eric.
Good afternoon, Governor. Good afternoon, Dr. Box. I think I have a question for each of you. Governor, let me start with you. I wanted to follow up on the question about what we might see in your upcoming address as far as where we're headed. Our neighbors to the east announced last week that when they get the number of cases per capita down to 50 per 100,000, that's when Ohio will reopen. Am I understanding your earlier answer correctly? There will not be a single metric that says we can lift things. It's going to be more intuitive based on a mix of numbers?
That is absolutely correct. We've tried to be very, not just clear, but consistent about that from the very beginning. That metric that we look at a lot is one recommendation. It comes from the CDC, by the way, and has been there from the very outset. So it won't be one thing. And by the way, when you do start to look at other states, and I'm on phone calls talking to various governors, it seems like every day. I think it almost is. And so I'm talking and listening to what others are going through. And when you there is no one single driver for these decisions that are made. And oh, by the way, I think that our Department of Health's credit vaccination process is one of the best in the country. And when I talk to other governors and they say, yeah, we're going to bring it down to 60 or 65, and we're at 50 going and adding, we're getting the most at risk. And so, this thing is not an either or if we hit this one number, in this case 50 per 100,000 over a 2-week period in a certain locality. This has a lot more to do with it. We talked about the 4 principles over and over and over, that PPE and the hospitalization rate, death rate, et cetera, early on. But as we continue to improve, we'll look at not just the road ahead, but a roadmap ahead as well. You had another question, Eric?
I did. I think this is probably more for Dr. Box. We've talked for several weeks about keeping an eye on the assorted variants out there. Either the British or the South African variant, I believe there's only 80 cases nationwide. The other one is not much more than that. They still haven't really washed ashore in the way that we're fearing. That doesn't mean it won't, but I guess that's my question. What are we watching for in terms of signs that one of those could catch fire? And what will be the timeline if that's going to happen? When would we look for a potential bump in our numbers?
Right, so we have seen in the United States a lot more of the UK variant, which is the B117 variant, and very minimal amounts of the South African or the Brazil variant. We do have a couple of spontaneous variants that have occurred in New York, one in California, and so we're watching those closely. Eric, we are randomly testing many specimens. If we see what looks like a kind of a clustered outbreak that seems to spread easily, we do testing there. Certainly, if somebody looks like they've got a reinfection, that would be a person that we definitely want to do the genomic testing. And the good news is our lab is now certified here, our public health lab, to be able to do that genomic testing here in the state rather than relying on the CDC to do that. So we've got a couple partners in the state in our lab that will be able to do that. We do have 28 cases of the B117 variant, and we know that represents many more cases that we just have not probably picked up on. So that is an underlying concern that I have, because we know that these variants will put a little dent in probably the efficacy of preventing that mild to moderate, potentially even severe disease. But most importantly, we do not believe that those variants currently decrease or increase the risk of hospitalizations and deaths.
Drew with Fox 55.
Afternoon, Drew.
Good afternoon, Governor. In the past, we've heard that there wasn't really enough information about how the vaccine would affect transmission to say whether vaccinated people could be in groups without masks. And these CDC recommendations seem to give a little bit of clarity. So will that in any way affect the guidelines in Indiana? And what sort of suggestions do you have for these fully vaccinated Hoosiers who might now be more comfortable and want to get out and start interacting with people?
Well, I think this is a great opportunity just to stress the importance of getting vaccination, or getting the vaccination, and what that means to getting your life back. I mean, this is a good thing. We ought to be encouraging folks to get vaccinated for that very reason, and it will, factor into my thinking in terms of how many people are using the supply that we have. And so when we see a kind of a slowdown in different age groups, that is, that concerns me in the sense that we got to continue to, all of us, not just the Department of Health, but all of us, whether we're in Sellersburg or South Bend or Gary or Evansville or Fort Wayne, all over the state of Indiana, if folks aren't vaccinated, they can get it and spread it. And so it just extends this, and we're doing so good. I'll just make an appeal to those folks who are 50 to 59, step up. You're going to help us all get through this sooner. So yes, the short answer is yes, it's one factor, one data point that we'll consider as conditions improve.
Brandon Smith, Indiana Public Broadcasting.
Afternoon, Brandon.
Afternoon, Governor. A fairly simple question for you. Why the 180 on getting teachers and school staff vaccinated at state sites?
Well, I would say it wasn't a 180 on our part. We had a plan. We were executing that plan very methodically. I would use the word, I think, perfectly or flawlessly. We made, per our federal partners, that vaccination available or they made it available through the federal pharmacy program, but they have also since required states to prioritize teachers. So that will have an impact on getting to that list of folks with comorbidities that Dr. Lindsay and Dr. Box have already this hour spoke to. So we were using data to drive all our decisions about those who were most at risk. The administration, our federal partners, have said you need to add in to any site, and so we will do that. And teachers, educators need to show up at a site with their ID starting on Monday, and we'll ensure that they get vaccinated.
Michael?
Brandon, did you have a second? You said you had one simple question. I thought that meant you had one simple and one difficult.
No, that was just the one today. Thanks,
Okay,
Kevin.
thanks, Brandon. Okay, next.
Michael with WBEZ.
Michael, good afternoon.
Good afternoon. Good afternoon, Governor Holcomb, Dr. Box, and Dr. Weaver. How do homebound individuals, people who are bedridden and care for at home, how do those people get the vaccine? I've heard issues from some folks that they can't get anybody to their homes to administer the vaccine. And my second question, and out of curiosity, with so many people who live in the south side of Chicago, the south suburbs, Calumet region, but work in Northwest Indiana, nursing homes, grocery stores, casinos, why was the change made to exclude those people from obtaining a vaccine since they come into Indiana regularly?
Yeah. You want to take the first or the second or both?
Sure. The homebound individuals, as you probably know, we have set up the ability for those individuals to reach out to their area agencies on aging or to AARP and to their private practitioner. We can actually get them put into a portal, which will then allow us to be aware of them within their county and their community. We do have, as you might imagine, to begin with, a large load of individuals that have been put in that portal in each county. So what we're doing is working with our partners in certain counties that have a larger number in the portal to actually give them vaccine that's not even just extra doses, but doses of Johnson & Johnson that we were hoping to be able to have these next few weeks and may not get, so that they can go out and just do 10 of these individuals or 20 of these individuals and start kind of bringing those numbers down. But if this individual or the person that you were talking to is already signed up in the portal, we will be getting to them, I can assure you. And then once we get the backlog kind of done, we'll just kind of be the new names come in and those names get taken care of.
And you want to talk to, or Dr. Weaver, you want to speak to the folks who live here but don't, or work here but don't live here, in terms of the multiple sites that we have in Lake County?
Right. So that was really important, especially early on when we were working with individuals in the healthcare setting, because we had a large number of people that came across the border and worked in different hospital systems, and the ease and efficiency of doing those individuals. We had talked with our neighbors in other states, and they were doing the exact same process. We started looking at the numbers of individuals outside of the state that were being immunized here in the state of Indiana, and found that it was an easier system for people to kind of sign up and get an appointment and come and get that done pretty quickly, and just began to feel like it was important that we started to narrow that down to Hoosiers that live here in the state. Individuals that may have other jobs, like the teachers that come across the border or something, or other industries, certainly have that opportunity to get vaccinated in their own state.
We'll go back to Dustin of WTHR.
Dustin, welcome.
Thank you, Governor. According to the dashboard, Hispanic and Latino Hoosiers accounted for, at last check, just over 2% of the people who'd been vaccinated. So I was wondering what the state has done to reach out to this segment of the population in particular, and what more needs to be done.
Mm-hmm.
Dr. Weaver, do you want to take that one, or do you prefer that I?
I can take it, or you can
Okay,
take it.
go ahead.
So we are doing specific outreach. I'm especially working with our community partners to make sure that they are reaching out within their community, within the Hispanic and Latino population, to talk about the vaccine, to talk about maybe some vaccine hesitancy, answer questions, and assist with signing up. Again, and I've mentioned this before, where we have really found a lot of success is when people assist others in signing up, and they do it as a group or as a team. Additionally, as I mentioned, we're going to be using our mobile units going out across the state, and those are exactly the type of populations that we hope to be able to target and work with to be able to provide vaccines at a local clinic or a community center or maybe a church. So again, so we can improve people being comfortable and have an opportunity to ask questions, especially if they need to speak in their own language. Work to make sure that we have interpreters on 211 to be able to answer questions and assist with signing up, and also on our rshot.in.gov. You have the ability of changing to using Google Translate to change to other languages.
Brock Turner, WFIU.
Brock, good afternoon.
Good afternoon, Governor. I have two questions. I'm not sure who wants to take these, but I know one is probably going to be for the doctors. So my question for the doctors is, can you describe how the Department of Health plans to enforce the visitation mandate on long-term care facilities? I'm still hearing from some caregivers and folks that want to get into facilities that the facilities aren't allowing them in for in-person visitation.
So the Indiana Department of Health has a regulatory division, and part of the facilities that we regulate are our long-term care or skilled nursing facilities. So we get complaints from families and from individuals across the state if those facilities are not following the particular guidelines that the Indiana Department of Health have put out, and we can specifically look into that with regards to that. I will say that part of this is that now that the CDC has come out with some new guidelines for individuals that have been immunized, we are very hopeful that we will see CMS come out with new guidelines with regards to individuals that have been immunized and visitation within long-term care facilities, because we have such a large number of our residents, a large percentage that have been immunized.
And Brock, I would just say that that's another, I mean, this is all part of our overall communication strategy when we're talking to our federal partners, is to seek, we want to remain as consistent and clear as we can. So whether it's on this topic or recommendations on travel, I mean, the more people that get vaccinated, this gets you back to your safe and normal life. And we want to make sure that we're constantly in sync or singing from the same sheet of music with our federal partners. I think you had a second question.
I did. Thank you for that clarification.
Yeah.
So there were several photos that surfaced over the weekend showing crowded gyms for high school basketball sectionals. Many of those folks were not wearing masks. How worrisome is that? And what's your message to local health departments who say they don't really have the enforcement power to be able to address those situations if folks are out of compliance?
Yeah, and that's why these plans need to go to the local health departments, and they need to get approved. I get it that there are a lot of basketball games or a lot of events. We're going to deal with this from now on, and it requires that local, and I mean very localized at the school level. But we want to keep our kids back in school, and so come on, we gotta do it safely. I want to go to the basketball games too, but I'll do it, and I'll do it per the guidelines. And I love this time of year. We're heading in the right direction. There's not too much we need to ask of one another, and this would be one of them.
Alexa with the State House file.
Good afternoon, Alexa.
Good afternoon. I would just like to say I love your mug also.
Oh.
Someone noticed.
Yes.
What does the sticky note say?
I can't tell you that.
Okay. So my first question is, as the eligibility for Hoosiers continues to change, what should Hoosiers who are undocumented or have visas should do about getting vaccinated?
When they meet the eligibility here in the state of Indiana, if they're residing here in Indiana, they may be vaccinated like any other individual.
And we want to encourage everyone who is eligible. This is going to speed up the process.
Elizabeth with WNIT.
Good afternoon, Elizabeth.
Good afternoon. The CDC guidelines allow vaccinated people to gather without social distancing or masking, or to gather with one other household, as Dr. Box mentioned earlier. It's for grandparents who haven't seen their grandchildren or children. Once they are vaccinated and their children are vaccinated, but the grandkids aren't, how important is it that they're only meeting with one family grouping at a time, opposed to a little family gathering just within that family, but it might be 2 or 3 households?
Bullseye. This is a great question.
It's a great question, and I'm probably not the right person to ask because I'm with my family, extended kids, and their spouses pretty much every weekend. So what I will say to you is, it's really critical that when there are individuals within that group that would be particularly at high risk of severe consequences or death, that is when you're more careful. If you know, like my husband and I have been both vaccinated, a couple of our kids have been vaccinated based on healthcare professionals, that consequently ends up being a more reassuring thing. I would say that kids, you know, as we know, can carry this. So being very careful that if that youngster has got a snotty nose or showing signs of infection, that those that are not immunized, or maybe a family member that might be pregnant or other issues, would be not at that gathering, because again, they would be at higher risk.
Better to be safe than sorry.
Max Lewis, WSBT.
Good afternoon.
Good afternoon, Governor. How are you?
Very good. Yourself?
Pretty good, thanks. I have a question, two questions actually. I think might be for the doctors, but I wanted to know, Dr. Box, there were some issues, a technical glitch apparently that was found by our local health department here on when people were to click Find Next Available Appointment on the scheduling website, it would take them to a date, but there would actually be appointments previous to the date it took them to. So I didn't know if you had any knowledge of that or had spoken with Zotec about that glitch at all.
Yeah, Dr. Weaver's shaking her head. We were aware of that, so I will let her handle that question.
Yes, we were aware of that, and it should be fixed now. So hopefully when you go to find next appointment, it'll actually show you the one that's closest in time.
When you build an airplane in flight, you make some tweaks along the way. Fortunately, we've been able to accommodate every stage, hundreds of thousands. And if you would have predicted that, so kudos to Zotec. Your second question?
Perfect, yeah. And then I guess I wanted to know, there's just looking through the vaccination website, there are lots of appointments that are open. Some I've seen have gone unfilled even today. I'm sort of wondering, because of the slow uptick with this age group, sort of why not open the floodgates and let some people who want to get vaccinated, push the people who aren't taking those appointments out of the way and get their vaccine.
Again, another question that we all talk about this, and the timing and synchronizing and calibrating, doing, not having vaccines sit on the shelf, so as you allude to or point to, but not getting ahead of ourselves and not, overpromising. So, Dr. Weaver, you want to talk about, because it is what people think about, and when you see in one site availability and you see, I'm 7 days out in another site, you want to just talk about how all the pieces fit together.
So it is really important to us that these vulnerable Hoosiers be able to get in and to get vaccinated. We are sending out messages every single day, as I mentioned before, 31,000 just this week, 31,000 plus just this week, and counting, to individuals who are at significant risk for COVID-19, that big long list of people that I just mentioned. So if we were to, for example, open the floodgates, then that would mean a lot of young, healthy people would be able to get in and take all of those spots very quickly, and then potentially push out those high-risk, vulnerable people out to a further time. So by carefully monitoring exactly how many appointments are not only just across the entire state, but every region, and we're adjusting where vaccine is getting moving to, and then slowly and methodically moving through these different vulnerable populations in order to get them vaccine as soon as possible. And I promise we push, and we're going to keep on going as fast as we get vaccine available.
Yeah, and it depends on how long you're at 55 or 50, or if you go to 45 or 40. So all these things factor in every day.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.